Si han observado las entrevistas previas que cubren en parte lo acontecido durante la Conferencia Anual de la AAOMPT, habrán notado que influyentes colegas de nivel internacional están altamente interesados en el intercambio con países hispano-parlantes. Este es un mundo donde las barreras geográficas se van diluyendo gracias a los avances tecnológicos. Nuestra empresa tiene como objetivo crear un puente que ayude a eliminar las barreras del idioma. Terapiamanualortopedica.com convoca a fisioterapeutas y agrupaciones profesionales de todo el mundo que estén especializadas en terapias manuales dentro del ámbito de la terapia física a formar parte de esta iniciativa de colaboración mutua. La doctora Nancy Mulligan, profesora y coordinadora clínica en el programa de terapia física de la Regis University, nos habla de su experiencia de intercambio con grupos de estudiantes estadounidenses que viajan anualmente a Perú.
Very large global health program. About 1/3 of our students do some kind of global health through their 3-year experience to get their DPT. And we take students down 3 years now in August for a service learning experience.
Very good. And have you been personally teaching?
Yes, I've been down there 2 times. And we set up the program via Catholic Medical Mission Board through one of our alumni. She graduated in 2010. She was down there working for a year, building relationships with several technical schools in Alice Peruanas, the physiotherapy school there in Trujillo, as well as doing some community-based rehab work.
How was that experience?
Oh, it was great. It was great.
Yeah.
And her name is Dr. Amber Walker, and she set up a 2-day conference at the end of her 12-month stay. So we went down there to teach at the conference to help support her work. And then the trips that we've gone on, which are annual, we hope to have them become twice a year, is to really just to support the work that she's done and continue it on in those relationships that we've built.
Was it fun for you to be there teaching?
Oh, absolutely.
In which way? Tell me a little bit about your pre-concepts and then the fact that you were actually there and teaching.
Right. Well, we've taught for 3 years now, and this year I felt like we really just everything kind of just gelled. We worked with a therapist from Lima, Ana Herrera, and she was my translator and my co-instructor. We did a classification of low back pain this year. And it was great working with her and partnering with her, and the physios were just so dynamic, ready to learn, very smart, and just, things just fell into place. It was really a really rewarding experience, and we learned from them as well. In the first year we did cervical pain, patients with knee pain, and then the second year we did do some things that was a little more neurological basis for the physical therapist.
Excellent. So probably in your program you have a very strong influence or emphasis on manual therapy techniques, correct?
Yeah.
So tell us a little bit, what is it that you guys are doing in terms of using therapeutic interventions using our hands in orthopedic cases particularly, but more so, what is it that you're doing in terms of research?
Since I do focus on clinical education, so I coordinate when our students go out in the clinics. We have a lot of community partners. My research focus is on that and the use of manipulation while they're out on their clinical experiences.
I see.
And then I also, we form a lot of clinical partners of people that are in our post-professional program, either our transition DPT or our fellowship program, and then work with those fellows to help work with the professional students.
Back to the idea of teaching in other countries, what is your motivation? Why did you start doing this?
Well, in 1989, I had the opportunity to live in Tanzania, in East Africa, and I worked there at a small hospital, and I worked with the American physical therapist there, training a couple of nurses' aides, and it was great, passionate people, similar to the South Americans, but it was so different because there was no technology. So we just worked with those 2 beautiful women that we taught them physical therapy. But now with technology, you can volunteer a couple of times a year, a couple of weeks. You could be here in the States, collaborating, through technology and Skype.
How are you using that? How is it that you're using technology to your advantage?
Well, we're building a relationship with Alice Peruanas, the PT school there in Trujillo, and we have plans, when I met with them in August, to start doing more case studies via Skype. So similar to what some of the fellowship and residency programs do in the United States, where we'll have cases, present patients, and go through some clinical decision modeling. So, we'll do a case one time, and then they'll do a case the next time, and we'll trade off, and utilizing the expertise at Regis so that if it's an area that I'm not comfortable doing, I can pull in another faculty member.